Being faced with the diagnosis of hypertrophic cardiomyopathy might seem scary, but I do want to emphasize that this is a very treatable condition, and we are constantly getting new medical therapies, new procedures, new diagnostic testing that have all been shown to help with this condition and get it to the point where we can get your quality of life the same as somebody without this condition. That's why it's really important to talk to your doctor to make sure you're getting the most up-to-date treatment for this condition. The main goals of treatment for hypertrophic cardiomyopathy is to improve symptoms. And most of the treatments do that by decreasing how strong the heart's pumping and reduce obstruction of blood flow of blood leaving the heart. And that in most cases improves the symptoms. The two first-line classes of medications for this condition are medications called beta blockers and calcium channel blockers. These medications have been around for ages. And what they do is that they decrease the pumping strength of the heart a little bit and also decrease the heart rate, which gives the heart more time to fill. If that doesn't work, there is another class of medications that also decreases the strength of the heart, how much it's squeezing. Cardiac myosin inhibitors are one of the newer drugs we have in this condition, and they work exactly where the problem is with hypertrophic cardiomyopathy, at the muscle cell itself. And it inhibits the way the muscles work and decreases the strength of the pumping function of the heart, which can then go on to relieve the symptoms. If you do have certain abnormal heart rhythms related to this condition, your doctor might prescribe an anti-arrhythmic drug to help control that. And rarely, some people go on to develop extra fluid buildup, and they might need diuretics, but those should be used cautiously because they can sometimes worsen obstruction. Medications are always first line when it comes to hypertrophic cardiomyopathy, but for some people, they're not enough. And if your symptoms are still progressing and your quality of life is not where it should be, despite your cardiologist having maximized all the medical therapy, well, then we go on to some of the more invasive procedures. And there's two. The one that's been around the longest is what's called a surgical myectomy. And so that's open heart surgery. There's another more minimally invasive procedure called an alcohol septal ablation. Both of these are effective treatments, and your cardiologist can help determine which of these would be best for you if you do need one of them.